been a week since you had your baby. I'm sure this week has been an absolute blur to you. You are probably still having some level of pain, especially if you had any perineal trauma, a laceration or a tear. If it was minor, those can take 2 to 3 weeks to heal. If you had a more involved one, expect 4 to 6 weeks. Make sure you're taking your pain medication as needed, using sitz baths. If you have a 3rd or a 4th degree tear, continue to take those stool softeners. If you had a C-section, you want to keep that incision clean and dry. Wash it with antibacterial soap. Keep it open to air. You may even want to put a heating pad on low on your tummy. That can promote circulation and healing. Again, take those pain medications as needed. Whether you delivered vaginally or via cesarean section, your bleeding should be about that of a normal menstrual cycle this week, maybe a little bit lighter. That dark red blood may be starting to turn brown. That's totally normal. You're probably having some cramping while that uterus returns to its normal size and shape. If this is not your first baby and you are breastfeeding, you are going to notice those cramps can be pretty strong. Again, a heating pad on low, pain medications as needed. You are probably very, very tired. After all, your body is in recovery mode, and you've got a little person in your house who's keeping really bad hours. Make sure you're getting as much rest as you possibly can. Remember to eat. Allow other people to do the dishes, help you with that laundry. You may be having body aches, especially if you pushed for a long period of time. Your chest, your arms may be kind of sore. You also may be having some tailbone pain. Again, you can use pain medication as needed. Taking a nice warm shower. Now may also be a good time to schedule a massage, help with some of those discomforts. Are you having night sweats? Some people do. That's that excess fluid that's just leaving your body. You may want to put a nice absorbent towel on your pillow. Make sure you're drinking plenty of fluids during the day so that you don't get dehydrated. You may be having problems with constipation, especially if you're taking pain medication that contains a narcotic, or if you've been afraid to have a bowel movement, so you've been holding it. Make sure you're drinking plenty of fluids, eating a high fiber diet, taking those stool softeners as needed. I always said that having a bowel movement after you have a baby is just like going to the dentist. You dread it, you dread it, you dread it, and then when it happens, you're like, okay, it wasn't that bad. Again, make sure you're taking those stool softeners. That can definitely help. You may be noticing breast pain. Your milk usually comes in right about postpartum day 3 or 4. Within a couple of days, that engorgement should go away. If you are breastfeeding, you are probably having some issues with engorgement. Your nipples may be really tender. If you are having pain, try to meet with a lactation consultant. Make sure that your baby's latch is appropriate. If you have severe pain in your breast, redness, heat, flu-like symptoms, those are symptoms of mastitis, and you need to seek medical attention right away. And finally, you most likely have some level of the baby blues. 80% of women report feeling weepy, irritable, cranky this week. Again, because you are tired and your hormones are fluctuating, and people are giving you advice that you didn't ask for. It is perfectly normal that you have that occasional bad day, that occasional meltdown. So what's not okay? A sudden onset of heavy bleeding, saturating a pad in an hour, passing clots as big as an egg. It's not okay for you to run a fever of 101.4 Fahrenheit or 38 degrees Celsius. Severe headaches that don't go away with Tylenol. Shortness of breath, chest pain. If you have pain in one leg and not the other, and that leg is red and hot to the touch. If you are having thoughts of harming yourself or harming your baby, you need to contact your provider right away. If you have any questions that I can answer, I hope that you'll leave those in the comment section below. While you're down there, I would love it if you just hit that like button.
You're still here. Thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from that information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.